Howdy y'all, thank you for joining me today on the Poop Tip Tuesday. So in today's video, we're going to talk about a couple different things. Number one, we'll talk about the new antibody treatments for COVID-19. You may have heard about this in the news. I'll give you the rundown on what those entail. Number two, we will talk about why do people have so much diarrhea? Yes, I know you're itching for those diarrhea questions. Number three, we will talk about what are the risks of sitting on a public toilet. Will you get sick? Will you get an STD? Is there an issue with that? You'll learn in today's video. Number four, we'll talk about what are called runner's trots. Why do you have to poop when you're running? And number five, we will talk about why you become constipated when you travel. And as usual, I'll answer any live questions you guys may have on today's Poop Tip Tuesday. So for those guys who are joining for the first time, my name is Dr. Islam, and yes, I'm an actual poop doctor. Yes, that is me. My passion is to give you tips and tricks to help out with your health. If you haven't already, I need you to do a couple of things. Number one, smash that like button. Like, share, and subscribe. Number two, let me know if you're watching this live or on the replay. And number three, let me know if there's any questions you guys may have on today's video. Amanda, it's great seeing you. Thank you for watching on the live video. So hope you guys are having a healthy and happy Tuesday. Thanksgiving is coming up. I'm excited. It's one of my favorite holidays of the year. Let me know what you guys are planning on doing. I hope you're not planning on doing a lot of traveling and meeting up with other people. With COVID-19 being on the rise everywhere in Texas, we need to be very safe and very cautious. And that segues into our first topic. What exactly is going on with the COVID-19 treatment? So you may have heard about these antibodies that are being produced by Eli Lilly in terms of treating COVID-19. And here's what you need to know about that. So these antibodies are particular ways for us to prevent the virus from attacking cells inside our body. And the early data seems to be very good for those patients who get this particular treatment. Now, a couple of caveats you have to know. Number one, there are not enough supplies for everyone to get this. So unfortunately, it's going to be very limited in terms of who's going to get this. Number two is that you have to have very mild or moderate symptoms. So you can't be one of those who are already sick or already in the hospital, already on oxygen from COVID-19, because you will not qualify for that. Number three is that you'd have to have other comorbidities associated with COVID-19. So for example, mild symptoms with possibly COPD or mild symptoms with some possible heart issues as well. These are the patients that may be getting this particular treatment. And number four, not everyone's going to be able to get this despite people being qualified. Only a very select amount of people are going to be able to get this because we don't have enough supplies. It's typically given as an IV infusion, given over an hour. And so you have to give this at a site that can give you an infusion. So not every infusion center can offer this because keep in mind, these are for those patients who actually have COVID-19. And if you have it, you are contagious to many other people. And for a lot of people who get infusions, they already are immunocompromised. So there has to be some sort of way for us to separate those people who are getting the COVID antibody treatment versus those who are getting infusions from something else. But it's exciting news. Hoping this is leading on to more and more options for patients who have treatment. But unfortunately, this is not indicated for those who have moderate to severe symptoms or those who are currently hospitalized. So that's what you need to know about that. And so if I hear more and more information on this, I'll update you guys on further live videos. Michelle, it's great seeing you. Thank you for watching. Mary, it's good seeing you as well. And Sylvia, it's good watching you. Thank you guys for watching on today's live video. So let me know if you have any questions about COVID-19 and the new treatments that we have and some of the other things, including the vaccine that may be coming out in the future. All right, question number two. I got this from a patient today who said, hey, Dr. Islam, I am wondering, why do I have so much diarrhea? Well, very good question. A lot of people have diarrhea. They may be wondering what is going on. So when it comes to diarrhea, there are a couple of different ways that we as doctors help to kind of classify this in our head. Number one, is this a infectious diarrhea? So we check to see if there's an infection. The clinical clues for us include whether you have fevers, pain, if you have a lot of nausea, if you had a recent travel to someplace, if you drank water from a bad place, if you ate bad food, if there's a epidemic of a diarrhea infection, then we know this may be an infectious cause. Or if you've been on recent antibiotics, you may have a condition called C. difficile diarrhea. That's one cause of diarrhea. The second one is there something that you're ingesting to cause the diarrhea? So things you may be ingesting that you may not realize include things like lactose or dairy. Very common reason for diarrhea. Number two is whether you're ingesting an artificial sweetener, so things like sugarless gums, maybe a diet drink, maybe stevia or a sweetener, something you're trying to do to sweeten up your meal or drink without having the calories. Very commonly, very commonly, it's a very common reason why people can have diarrhea, because their GI tract cannot absorb that. Or number three, maybe your body is secreting something inside you. Maybe it's you have an imbalance in some hormones, or you have some sort of problem going on with your pancreas, in which you have something there causing secretion of certain hormones or certain things that are going on there as well. Number four is that you actually may have an inflammatory condition for your diarrhea. So things like Crohn's or colitis. You may notice if you have this is if you have really bad diarrhea to the point where it gets you up in the middle of the night to have a bowel movement. You're having weight loss, you're having joint pain, eye issues, skin issues, a lot of just systemic inflammation that's going on that can point to the picture of what's called inflammatory bowel disease. Or lastly, you may have a condition called irritable bowel syndrome. Very common cause for diarrhea. And for a lot of people, this can be very frustrating because there's no real good diagnosis treatment or diagnosis tests that we have to tell you have irritable bowel syndrome. It's mainly just us listening to you, maybe excluding some of the bad things and making sure nothing else is going on in there. But these are the very common reasons why we kind of classify in our head of why you're having diarrhea. And based on that, we can determine treatment. So for example, if you're ingesting something that causes diarrhea, well, the first thing I'm going to tell you is to stop ingesting that. One of the common things I tell my patients, if they're having diarrhea, number one, just eliminate dairy. There's no reason for you to take dairy. You don't need the calcium for that. You get calcium from other ways. Number two, I tell them flat out, eliminate all artificial sweeteners. So look and see what you're eating. See if there's anything in there that has the xylose, sucralose, or things like that. If you're adding stevia or Splenda to your coffee, get rid of that. Or if you're having maybe sugarless gums, get rid of that. These are the first two things I recommend. If you're having a condition like Crohn's disease or ulcerative colitis, we're going to have to control the inflammation, at least initially, with medications. Then over time, we can make adjustments to your diet to keep your inflammation down. If you're having a condition like irritable bowel syndrome, we can change your diet. We can adjust your microbiome. We can give you medications. We can handle your stress. A lot of different mechanisms we can do to treat that as well. And then lastly, if you have an infection as a cause for your diarrhea, we can give you antibiotics to treat that. Or if you have an infection like C. difficile diarrhea, we can give you antibiotics. And yes, we can give you a fecal transplant. We can ingest somebody's healthy stool into you to help cure your diarrhea. Yes, amazingly, we can do this. We can hopefully get your diarrhea taken care of. So these are the common reasons why people may have so much diarrhea. Great question I got today. Sylvia, it's good seeing you. Once again, Elizabeth, good seeing you. Aspartame, yes, exactly right. Aspartame, I'm going to put this on here. This is a very common reason why people can have diarrhea is that. You are exactly right. Gary, it's good seeing you again. And B, it's good seeing you again as well. Thank you guys for watching on the live videos. And Diana, thank you for watching. Yes, I'm hoping you guys are getting great information. This is my approach when it comes to diarrhea. All right, question number 3. I actually got this from a DM from a patient. Dr. Islam, what are the risks of sitting on a toilet seat? Now, come on, guys. I know you are wondering about that, and maybe you're too shy to ask me, but that's okay. That's why I'm here. I'm your poop guru. So, what are some of the risks? You may have been worried, you may have seen things about, oh my gosh, if I sit in a public toilet seat, I'm going to get really sick. I'm going to get some sort of infection. I may even get an STD. Well, let's kind of break the myth. So number one, in the vast majority of cases, you are not going to be getting sick from a toilet seat. Number 2, you will not get an STD from a toilet seat. Number 3, you cannot get hepatitis from a toilet seat. So I just want to eliminate those. Now, the biggest risk factor when it comes to toilet seats is the aerosolization of the bacteria in your stool. So your stool may actually have infections, and that the stuff in the toilet water can also have infections as well, like viruses or bacteria. Whenever you flush, that can be aerosolized, or you may actually accidentally touch those areas. So if you have bacteria or infection in your hands and you eat food, touch your face, maybe cough, or I don't know, put your hands all over your face, you're going to get sick from the transmission of the bacteria from your hands to your mouth. So here's what you need to be safe. Obvious, wash your hands. If you wash your hands after you use the restroom, even in a public space, there's a very good chance you will be safe and protected from that. Number 2, if you are concerned, it is very safe to use a sanitizer to sanitize the toilet seat to make sure everything is doing okay, and obviously make sure that you're not sitting in a toilet seat that's very dirty. And number 3, if you want, You don't have to sit on the toilet seat. You can just squat over it. Now, I don't know how you're going to do this. Maybe you're limber or you're able to do yoga or the toilet seat's low, but that would be a way to help you to prevent from getting an infection. But by and large, it's pretty safe for you to be in a toilet seat that's public and to not have any significant risk factors as long as you wash your hands after you use the restroom. Guys, wash your hands. This is going to be the most important thing you can do to protect yourself and protect yourself from a public toilet seat. Great question I got today. Mari's good seeing you. Valerie's good seeing you as well. Flushable wipes. Let's talk about that. Justin, good question. So, flushable wipes are fantastic. So, I think the question is, well, I'm gonna answer the question my way. So, a lot of people ask me, what can I do to keep clean? And that's probably the most important thing because people want to feel clean. So my number one tip that you can do at home, to be frank with you, is to buy a bidet. These are fantastic. I am like a bidet expert. If you want, let me know in the comments if you want me to give you my recommendation for what bidet to get. I am just fascinated with this. So I have tried pretty much every single bidet out there. I've tried Japanese bidets, which are really cool. I've tried bidets on Amazon, but the best way to keep yourself clean is to use a bidet. They're simple, it's easy, and it'll keep you clean. Now, if you're out and about, and you can't have access to a bidet, yes, using a flushable wipe is great. I will tell you though, be very careful because flushable wipes may have alcohol in them and that can irritate your bottom, make it more likely for it to be itching, make it more likely for it to be irritated, more likely for you to cause hemorrhoids and cause pain. So just kind of be aware of that. And so look at the ingredients of the wipe to make sure that they are safe for you. Great question that I got there. Annette, thank you for watching. Thank you for that. Ashley, it's good seeing you again. And Mary, yes, I will give my recommendation to do that. Thank you for doing that. All right, perfect. Great question I got today. All right. Question number 4. So I actually got this from an athlete who I saw in the clinic a couple of weeks ago. He said, hey, Dr. Islam, I'm a cross-country runner, but every time I run, I have to use the restroom. What is going on and how can I fix it? All right. So for those of you guys who are runners or going about or athletes, you may have heard about the runner trots or the runner poops or other words like that. This is the problem whenever people run is that, man, I gotta go right now. And there are a couple different reasons why. Number one, when you're running, keep in mind you're slushing everything inside your gut. And whenever you slush things through, this can give you the urge to have indigestion, heartburn, and sometimes also the runs as well. Number 2 is that you're also putting blood flow away from your stomach to the other areas, your muscles, your arms, your legs. And that decrease of blood flow can make it more difficult for you to have kind of accurate bowel habits and cause pain as well. Number 3 is whenever you're exercising, you're actually increasing the motility of your GI tract. Things are moving through quicker. And so exercise is a very effective treatment that we recommend for constipation. But if you're running, this can make it a little bit more likely for things to pass through as well. And the next one is that keep in mind when you're running, you're increasing your stress in your body. Your stress hormones are high. And when your stress hormones are high, this will make it more likely for you to have to use a restroom. So what can you do to prevent this? A couple things. Number 1, just like you train your body for a marathon, you can train your body to use the restroom before you go. And I would recommend if you're planning for a marathon, you're planning for a big run, or you're planning to do something like that, train your body to use the restroom before. And you can do that by effectively having that time to kind of prep your body for that. Number 2 is that make sure you don't eat within 3 hours of the event because that's the usual time when things want to go through, and that's how long it takes for things to go through from your stomach to your GI tract. Number 3, avoid some of the foods that can cause diarrhea or loose stool. So things like processed foods, oily foods, fatty foods, chocolate. These are things that can make it more likely for things to pass through and also to cause gut issues as well. And number 4, or 4 or 5, don't forget to kind of plan ahead of time, if you can, your route. And so if you know that, hey, I'll be going down a route towards a restroom, see if you can kind of plan for that so you can make sure you have the right things and you can deviate appropriately. Guys, thank you for great question on that. Thank you. Oh, Dennis, thanks for watching. Thank you for watching. I really do appreciate that. And Gary, once again, thank you for your comments as well. Thank you, guys. All right. Now, question number 5, my last question I have prepared is a question about constipation and traveling. So I got this question and I saw this. I was like, this is a perfect question. Hey, Dr. Islam, when I travel, why am I so constipated and what can I do from that? Let me know in the comments if this is you, because this is me for sure. When I travel, I just get stopped up and it's a pain, a literal pain in the bottom for me. And let me know if that's the case for you. So there are a couple different reasons why. Number one, obviously, whenever you're traveling, you're changing your routine. So normally most people have a routine when they use the restroom. They get up, do what they need to, maybe use the restroom, maybe they use the restroom after lunch or after dinner. There's a set routine for when they go and your body is used to that. When you're traveling, you're obviously not going through that routine. You're not doing the same things that you normally do. Maybe waking up later, staying up later, having more fun. You're not doing the normal things that you do. Number two is that whenever we're traveling, a lot of us don't realize that we are not drinking enough water. That's one of the key components when it comes to constipation. And so whenever you don't drink enough water, whenever you're out and about, or you're drinking alcohol instead of water, or you're drinking other drinks, this will dehydrate you and make it less likely for you to use the restroom. Number three is that you may not be eating the best things when you're out and about and having a vacation. I'm guilty of this. When I go on vacation, well, I haven't gone on vacation lately, but when I did, man, I went crazy when it came to food. I did not care to my diet. I was like, I am having a good time, and I did pay the consequences for that. And so what can you do to help out with that? Well, a couple of simple things I'm going to recommend. Number one, increase your water. It actually does work. Now, try to drink as much water as you can and drink enough water so you can at least get the hydration that you need to make it easier for things to pass through. Number two is that if you can, try to stick to your normal routine that you did when you weren't on vacation. So if you use the restroom in the morning, try to use it. Even if you can't go, get your body used to that urge to go ahead and go, because your body will respond to the acts that you do. Number three, if you do need to use something to help you go, it's very safe to use some magnesium, maybe some Miralax, or maybe a small stool softener on the occasional basis. These are very safe things to do, but obviously verify with your healthcare provider to make sure you can do that. The next number is, if you can, I know this is hard on vacation, especially when you want to eat so well, but try to incorporate vegetables and fruit. These are things that will help you use the restroom, increase the amount of fiber, get things going to allow you to have more effective bowel habits. And these are things that I have found that works for me whenever I'm stopped up on vacation, and I'm hoping it'll help out for you guys as well. All right, Dennis, so good question. So let's ask this. So, Dr. Islam, have you ever heard of mastic gum? Gastritis groups, I know, swear by them. My question is, why does gastritis last so long after H. pylori eradication? So, two questions I can answer for this, Dennis. Number one, I have not heard of mastic gum, which means that I can probably bet you there's no clear clinical evidence for this. I will actually look this up. I'll answer this on next week's Poop Tip Tuesday. But I can almost guarantee you, if I have not heard of it, the medical community hasn't, which means that there's not a lot of good evidence. Now let's talk about H. pylori and gastritis. So H. pylori, and if you may have seen my Instagram video today, which I posted about a patient that had a H. pylori gastritis in the stomach. So H. pylori is a bacterial infection in the stomach that very commonly can cause gastritis, inflammation, pain, and nausea. The risk with H. pylori is that it is considered a pre-carcinogen. It can lead to gastric ulcers, can lead to gastric cancer, and can lead to gastric lymphoma. Now, this can be at times very difficult to treat, and the reason it can be difficult to treat is because of the prevalence of the number of antibiotics that we've used here in the United States, or pretty much across the world. So we give antibiotics for everything under the sun. Viral infection will give you an antibiotic. If you have a sinus infection, we'll give you an antibiotic. This leads to antibiotic resistance, and H. pylori now is becoming more and more resistant to other medications than what we gave before. And so we're having to maybe try more aggressive therapies, but sometimes those aggressive therapies don't work. It works in 80% of our patients with H. pylori. There's 20% in which it doesn't work, and so it's 20% that can be more and more difficult to treat. And we're trying to find more and more better treatment options for these patients. And sometimes that gastritis can last for quite some time until we can fully eradicate that H. pylori. But keep in mind, though, one more thing. When we use antibiotics to get rid of H. pylori, we're also changing the gut microbiome because of that. And so your symptoms may not be from H. pylori. Your symptoms actually may be from a change in your gut microbiome to make it worse. And this may be the reason why you're having gut issues. And this is a very common reason why people have gut issues, is because they had antibiotics unnecessarily when they were younger that changed the gut microbiome, and that in turn can cause you to have bloating, distension, and things like that. So very good question. All right. All right, guys, but I will answer that question on the next Poop Tip Tuesday. So, couple of housekeeping tips. Number one, please smash that like button, like, share, and subscribe so all the social media giants know what we're doing. Number two, if you want to be featured on my next Poop Tip Tuesday, the best thing that you can do is sign up for my newsletter. I'll put a link down below where you can get the great tips. I'll put out email information, and if you have a question, you can send it to me, and I can answer it on next week's Poop Tip Tuesday. But I hope you guys have a happy and healthy week. I look forward to seeing you guys next Tuesday. Take care, guys. Thank you. And thank you for being on the live video.